Buspirone is an anxiolytic agent used for short-term treatment of generalized anxiety and second-line treatment of depression. In this video, let's find found. What is buspirone? What is buspirone used for? Contraindication. What are the side effects of taking buspirone? How does buspirone work? How to use buspirone? Buspirone is an anxiolytic agent used for short-term treatment of generalized anxiety and second-line treatment of depression. In this video, let's find found. What is buspirone? What is buspirone used for? Contraindication. What are the side effects of taking buspirone? How does buspirone work? How to use buspirone? What is buspirone used for? Indicated for the management of anxiety disorders or the short-term relief of the symptoms of anxiety. Buspirone is an anxiolytic agent used for short-term treatment of generalized anxiety and second-line treatment of depression. In this video, let's find found. What is buspirone? What is buspirone used for? Contraindication. What are the side effects of taking buspirone? How does buspirone work? How to use buspirone? What is buspirone used for? Indicated for the management of anxiety disorders or the short-term relief of the symptoms of anxiety. Pharmacodynamic. The clinical effect of buspirone in alleviating the symptoms of generalized anxiety disorders typically takes 2 to 4 weeks to achieve. The delayed onset of action of buspirone suggests that the therapeutic effectiveness in generalized anxiety may involve more than its molecular mechanism of action 5-HT1A receptors, or buspirone may induce adaptations of 5-HT1A receptors. Unlike benzodiazepines and barbiturates used in anxiety disorders, buspirone is not associated with a risk for developing physical dependence or withdrawal, or any significant interaction with central nervous system depressants such as ethanol. This is due to the lack of effects on GABA receptors. Buspirone also does not exhibit any anticonvulsant or muscle-relaxing properties, but may interfere with arousal reactions due to its inhibitory action on the activity of noradrenergic locus coeruleus neurons. Mechanism of action. The therapeutic action of buspirone in generalized anxiety disorders is thought to be mainly derived from its interaction with 2 major 5-HT1A receptor subtypes that are involved in the brain's anxiety and fear circuitry to enhance the serotonergic activity in these brain areas. Buspirone as a full agonist at presynaptic 5-HT1A receptors, or 5-HT1A autoreceptors, expressed at dorsal raphe while acting as a partial agonist at the postsynaptic 5-HT1A receptors expressed on hippocampus and cortex. 5-HT1A receptors function as inhibitory autoreceptors by being expressed on the soma or dendrites of serotonergic neurons or mediate postsynaptic actions of 5-HT by being highly expressed on the corticolimbic circuits. They are inhibitory G-protein coupled receptors that couple to GI/GO proteins. When activated, presynaptic 5-HT1A autoreceptors cause hyperpolarization and reduce the firing rate of the serotonergic neuron, thereby decreasing extracellular 5-HT levels in the neuron's projection areas. Activated postsynaptic 5-HT1A receptors promote hyperpolarization to release 5-HT on pyramidal neurons. The anxiolytic action of buspirone is mainly thought to arise from the interaction at presynaptic 5-HT1A autoreceptors. Acting as a potent agonist in these receptors, buspirone initially causes activation of these autoreceptors and inhibition of 5-HT release. It is proposed that buspirone induces desensitization of somatodendritic autoreceptors over time, which may explain the delayed onset of action of the drug. Desensitization of the autoreceptors ultimately results in heightened excitation of serotonergic neurons and enhanced 5-HT release. Buspirone also displays a weak affinity for serotonin 5-HT2 receptors and acts as a weak antagonist on dopamine D2 autoreceptors, although there is not much evidence that the action at these receptors contribute to the anxiolytic effect of buspirone. It acts as an antagonist at presynaptic dopamine D3 and D4 receptors and may bind to alpha-1 adrenergic receptors as a partial agonist. Half-life. In a single-dose pharmacokinetic study of 14C labeled buspirone, The average elimination half-life of unchanged buspirone following administration of single doses ranging from 10 to 40 mg was about 2 to 3 hours. Dose. Anxiety disorders. 10 to 15 mg/day PO divided Q8-12HR may increase every 2 to 3 days by 5 mg per day to 15 to 30 mg/day PO divided Q8-12HR, not to exceed 60 mg per day. Smoking cessation, off-label. 30 to 60 mg/day PO for 9 to 13 weeks, begin 2 to 3 weeks before quit date. Safety advice. Advice and warnings for the use of buspirone during pregnancy. FDA Pregnancy Category B. No proven risk in humans. Dose. Anxiety disorders. 10 to 15 mg/day PO divided Q8-12HR may increase every 2 to 3 days by 5 mg per day to 15 to 30 mg/day PO divided Q8-12HR, not to exceed 60 mg per day. Smoking cessation, off-label. 30 to 60 mg/day PO for 9 to 13 weeks, begin 2 to 3 weeks before quit date.